All right, Mr. Kumar, if you could tell us about the current projects of your organization.
Okay, I represent Regency Healthcare. Regency Hospital Limited is almost 20 years old healthcare organization. We have a super specialty health, hospital in Kanpur, almost 300 bedded hospital. Almost 3 years back, we realized the need of a specialty kidney care setup. So we had set up a specialty kidney care hospital which does kidney transplants and dialysis. We did a tie-up with Regency Healthcare for a dialysis machine to give dialysis services. There was a lot of demand-supply gap in this region. In fact, still there's so much of gap that we wish to multiply our setups of kidney and centers and especially dialysis care. So this again the second setup, including the earlier setup, we have almost done 110 successful kidney transplants. That's a very high statistics and successful statistics besides the government setup out there. Thirdly, when I came in the organization as CIO and head of new initiatives, management entrusted us a responsibility to set up a rapid deployable model of healthcare setup. And so the first center which we did was a wellness center. So this the flavor of this setup is that this is the third setup, which is specialty OPD clinics, dialysis center, as well as high-end diagnostics and a wellness center. So there was a lot of again a gap in understanding concept and flavor of wellness in that region. And we were the first one to bring in this concept, and this center is almost running for a year. This is a daycare center, so if you talk about numbers and keeping cost under control, so the flavor was that we'll close down around 10:30 in the evening, in the night, and open up around 7, so the kind of cost we can bring into control. And this model has become so successful, especially the wellness part, that we would be deploying the same rapid deployment model of wellness clinics across different cities in the state and neighboring states. There are other two projects which we are working on and which will be launched very soon. We are setting up a large cancer care hospital, and that would be a center of excellence for cancer care, which we are doing in joint venture with HCG Global. So HCG itself is a well-known name in nationally and globally for cancer care. So we are doing radiation oncology top of the linear accelerator we are putting up. We are putting 2 bunkers, 1 linear accelerator at the first instance, and subsequently second linear accelerator. We would be doing radiation oncology. We would be doing everything in surgical. So cancer, surgical oncology, and then medical oncology. So that would be a dedicated center for cancer care. We are doing another multi-speciality hospital in the same region because we realize that there are certain areas where people have to travel down. Their geographical saturation of, demographically, there are a lot of people staying in that region, which again there's an absence of proper hospital in one of the portions, Kanpur. So the main intent was that once we are through and through with all the perspectives in Kanpur, we'll be moving to other cities. So these are the current live projects. Again, we are working very aggressively to move to other cities in the same region in UP as well as neighboring states, including Bihar. So that's what we can share about the projects.
All right. So these all are urban projects.
I wouldn't say it's urban. See, we are right now in a tier 2 city. So as it is, tier 1 flavor is entirely different. So tier 1 comes your NCR, your Bengaluru, your Mumbai. So we are currently into tier 2, and we'll be moving to tier 3 cities also, like we can say Gorakhpur. We are targeting, these are the areas what we are scouting for opportunities or spaces to cater to. Then let's say Agra, let's say Lucknow again is a tier 2. So we are primarily focusing on areas which were untouched by the larger players and give a flavor of cost effective care in this region in a more structured environment with the kind of expertise we have.
What is the rural reach of your organization?
Okay. We have almost 70% patients coming from rural area to us, and that's what the statistics show. I'll be very frank about sharing the demographical approach, and if I put it very simply, is that still people are, crazy about hospitals in Delhi and Gurgaon. I won't take the names. So people who are affluent, they can afford, they spontaneously think about moving to or driving down to or taking our ambulances. In fact, we have top of the line ambulances, and we don't enforce upon anybody to, if we own the ambulances, to take the clinical care at hand. But then most of the people who visit us are from that region and from the rural area and the surroundings. So our marketing team have been meeting all the clinicians, giving them inputs and feedback about the patients, what they send across. So I would say that's a unique mix wherein the urban flavor is almost 30% and 70% is the rural area we in catch upon. So, and the reason for that is that we give good clinical care and we are economical. So that's the flavor we have to maintain.
Right. So you are both taking care of the challenge, affordability and accessibility.
So we have to be very, very price conscious because the market is price sensitive, and for a procedure somebody would be charging 1 lakh rupee, we end up charging 10-15,000 bucks. So we are very, very, I wouldn't say price competitive because there's practically no competition in the region in terms of flavor of clinical care we offer. We are at par with almost the pricing in terms of government hospital. And of course the cost of a corporate hospital, end-to-end air conditioned setup would be there, so that margins have to be accounted for, but we are very, very economical in terms of services what we offer.
That is absolutely wonderful. Right, so if you could tell us your thoughts on Swasth Bharat Sabka Vikas.
Okay, see, generally if you ask me this question, we have
let's frame it all policies of government.
Okay, so I should be very fair because commenting on a gross level, on a national level, for persons like us, because we have worked exclusively in corporate kind of setup. I won't say corporate in an expensive corporate kind of setup. We have worked in, I have been very lucky to work in top of the expensive line hospitals to the averaging pricing hospitals to a hospital which is extremely price conscious. But when we talk about on a national level, then we have to cater to tier 3 cities and essentially rural area. So when we talk about reaching out to everyone, I would say it has to be a mix of approach and support from government largely and from the private players. When we talk about private players, they have to outreach because frankly speaking, if you don't catch me for the literal sense of words, healthcare setups or hospitals have a specific strength to accommodate patients. Unlike, even think about hotels, a person would come and predict his stay for 4 days, but in a hospital nobody comes in predicting his stay. So again, as a restaurant, the number of tables get occupied is the number of people you can churn out as your customers. Again, for a hospital kind of setup, if you want to reach to everyone, it is not only essential to create more healthcare setups. I think the essence would lie in the success of this program would be to have an outreach at the doorstep of the people. So the program should not limit to adding more primary care hospitals or secondary care hospitals in the region. Should be there, but more to have reach to the patients, the people on their doorsteps, essentially to the rural areas. So the programs wherein again I can add to my technological flavor with kind of portable healthcare devices, portable diagnostic devices, vans with diagnostic equipment capabilities. This is the flavor that has to be adopted, and I think the government and the Prime Minister and everybody is much more beyond than me, and they were far more informed and far more having resources. But according to me, that's my own assessment and understanding that it has to reach to everyone. And I don't mind adding to it that if you can charge a little bit to people who are affluent, and for the poor people you can make it completely free or very, very economical. That's the essence should be.
Anything else you would like to add apart from, if there is,
We were doing a very interesting analysis and assessment lately that when we go from tier 2 to tier 1 to tier 3 cities, the flavor of patient care really varies, and that was a very new perspective which we came to us in form of that when we go to a tier 1 city wherein you have the A's, that is Apollos, F the Fortises, and the M the Maxises, and South Manipal and other big names. There the brand and the doctors drive patients. So essentially patient visit these hospitals, and from my perspective I believe because it's an organized structured setup, so a certain level of assurances of clinical care can be expected. But when you go to tier 2 cities, what we have observed is patient either move to metros for their clinical care or they visit certain hospital, but I've seen that majority of people try to reach out to the doctors in the neighborhood, and that's where the quality of clinical care gets affected. We have been realizing last few years that when patient get sick to the level 2 or illness comes to level 2 or level 3, is that's the point they realize that okay, now we have to go to a structured setup. Unlike in tier 1 city where it has come in the culture that you will visit a proper hospital, whether it's a government hospital or a private hospital. So at first instance there in tier 1 city, you get accessibility or you yourself reached out to a structured setup. Whereas in a tier 2 or tier 3 city, it so happens, and I'm not against that, but it has been observed and analyzed that a private practitioner has a tendency to prescribe medications which are probably known to him only or to the company which is manufacturing, and the entire other part of the world is unaware of that medicine exists. So I wish to be very explicit on this is that probably there is a vested interest in prescribing that medicine, and that medicine has been found to be sold out in a pharmacy which is just in the vicinity of his own personal clinic at home or a nursing home. So that's where first instance you were unwell, you were sick. Second instance you've been administered a medicine which is not believed to be a standard and well accepted and well adopted medicine. Thirdly, random investigations are ordered, so there is no control or enforcement over it. I would say grossly there is no enforcement in a larger scale, even on corporate hospital also. I shouldn't hesitate to say that. But when you work in a hospital or when a patient visits a hospital, at least there is some say out there. The patient can claim or can reach out to someone or escalate his problem or escalate his the kind of quality of care which was offered to him which he was dissatisfied with. At least somebody will listen to him. But when he goes to patients, doctors like this, and at times quacks, and I've seen patients coming to us with a small parchi which is something is scribbled on it, and probably what you can read is only his name, the patient's name. There is no doctor's name, and he has been getting treatment from this particular doctor for last 1.5 years. You don't know what has been administered to him, and that's where the things go wrong. So you are tackling with the real disease and tackling other part of which is the induced complication. So I'm not blanketly trying to say that most of the doctors do this, but there's a large segment of clinicians who are practicing from home and they are not being monitored. So when we talk about the Prime Minister's government's approach, they should try to bring in certain enforcement on these kind of practitioners, at least in terms of diagnostics or kind of availability of medicine. You cannot, for a single combination or single formulary, there could be at least 10, 20, 30 types of medicine or brand names available. So they should not let these kind of medicines be available in the pharmacies which are exclusively available to only 4-3 pharmacies. So that's my perspective is.